Site of injury, it could be in the form of your cell body's affectation, your axonal affectation, dra kasunod si neuropathies or si plexopathies, neuromuscular junction, and your muscle, which is your muscular dystrophy or your myopathy. Okay? And other any combinations. So from the definition itself, if this is a group of disorder affecting your muscle, so obviously, the common manifestation or the most common manifestation is muscle weakness. So expect that all of the conditions later will have a manifestation of muscle weakness. But nakadepende if it depends sa pattern of muscle weakness. It could be distal over proximal or proximal over distal. Okay? Question? Okay. So, the basic anatomy, this is the anatomy of your muscle. No, this is the anatomy of your muscle. So, here, diba, this is a bone. This is your tendon. And this is your muscle. The purpose of, again, of your tendon is what? The attachment to your bone. It attaches or it connects the muscle to your bone. This is your skeletal muscle, no, or your muscle. The outer covering of your muscle is what we call what? Myelin sheath. Myelin sheath is another form of connective tissue. But ano nga structure ang ga-cover sa muscle or the outer covering of your muscle? It's
Letter S.
myosome. It's epimyosome. That is the outer covering of your muscle or the external part of your muscle. If we go into specific part, we have here your fascicle. Wala na include si fascicle, but this one is your fascicle. Kung ano ang nagwa siya sa muscle, no, that's what we call your fascicle. Your fascicle is a bundle of muscle fibers. Knowing nga inside of your fascicle is your muscle fibers. Okay? So, the muscle is composed of several or multiple fascicles. Your fascicle is composed of multiple muscle fibers. So, ang cover sa inyong fascicle is your epimyosome, ang cover sa external. Your fascicle is what? Is perimyosome. And ang covers ang inyo nga muscle fiber is your endomyosome. Okay? Gets? If we go pagid microscopically, di ba? Si muscle fiber is still composed of different structures. I want you guys to focus more on your myofibrils. Di na dito kita ma-start ang component of your muscle contraction. So the myofibril is a contractile structure of the muscle. So basically, this is responsible for muscle contraction. Secondary to what? To the interaction of your actin and your myosin. If mag-interact si actin and myosin, it will lead to muscle contraction. You go back yapon sa process of your muscle contraction. We have, I think, several reasons why there is muscle contraction, and one of the reasons is the exposure of your actin to your myosin. Okay? We're good? So I think, one, i-discuss yung anatomy. Amo lang gidi siya. Followed by, alam ko yung muscle lang na siya. So you go back yapon sa ano. Okay lang, just some information about the muscle. Okay? And if gusto nyo, i-mention yung each muscle. Ang oina sa muscle. Charot lang. Pwede man i-mention nyo lang si muscle and then the basic anatomy. Okay? Also, this is the overview of your muscle fiber. The muscle fiber. Familiar pa, Fisho? So the muscle fiber is divided into two. We have your type 1 and your type 2. But your type 2 is divided yapon into two forms. We have your type 2B and type 2A. No, the type 1 is low oxidative fiber. So basically, it allows or it receives a lot of oxygenation compared to your type 2A and type 2B. The type 2A may siya yapon slight oxidative and your type 2B is fast glycolytic fiber. So, the most important lang here is that your type 1 is again slow. Slow siya in nature. It allows slow contraction and high aerobic capacity. It's slow ang iya contraction, so basically, it can stand muscle contraction for too long. So if the muscle, if your muscle, or if you wanted that your endurance will stay for too long, you need or you are using your type 1 muscle fiber. Okay? Basta gari mga muscle responsible for endurance, usually they are under your type 1 muscle fiber. Okay? And usually guys, mga small muscles or short muscles lang siya. AKA, we have your postural muscles, like your soleus, no? Nga gastrocs, na nag-contract lang siya guys. Even though, nag-contract lang siya, not forcefully, but, you know, like constant contraction lang in order for you to maintain, for example, standing, etc. etc. We'll talk about type 2A and type 2B. This is usually, guys, fast contraction or fast speed in terms of contraction. So, if you want, if you do forceful activities that will use a lot of energy, usually you're using your type 2 muscle fiber. Okay? Usually, yung sa mga basic in nature ng muscle contraction, it uses what? Forceful use of your muscle. This is under your anaerobic naman yung mechanism. If this one is aerobic, this is for endurance, no? It allows you to use your muscle for too long. This one naman, it's not. It will only use the muscle if it requires a forceful muscle contraction. Okay? Okay lang? Question? Question? Okay. So let's talk about your muscular dystrophies or your dystrophies. Can you check, guys, the conditions under your muscular dystrophies? We have your
LGMD.
5 lang, di ba? 5 lang. We have your DMD. Ano na ba, guys? Ano lang? Followed by BMD.
Sedan.
Followed by
Becker. Ay, okay. Machine, Becker.
Fascious capillohumeral dystrophy. Followed by limb girdle muscular dystrophy and your DM. Dystrophic myopathy. Okay? So, amo lang din siya guys, ang need nyo explain under your muscular dystrophies. So, jutay lang yun. Jutay. Diniscuss sa palengke na. Just kidding. So let's talk each of the conditions. Okay, just an introduction of your muscular dystrophies. This is a group of inherited progressive muscle disorders characterized primarily by your muscle weakness. Again, characterized by your muscle weakness. We talk about your muscular dystrophy, usually progressive muscle weakness or progressive in nature, caused by genetic mutations. Now, genetic mutations that produce muscle fiber necrosis and regeneration. Why? Muscle fiber necrosis, it's because your genetic mutations can sometimes lead to your tissue death. And also your regeneration. Regeneration in your muscle fibers, knowing that the genetic mutations is already ano siya daan sa body nyo. Okay? Ang gene nyo may problem na already. Your body is trying to regenerate or to heal the affected or the problematic cell. But it's because your body is already producing problematic cell, your body cannot no, cannot regenerate enough. Okay? Since, di ba, ang cells na daan nga gina-produce, no, sa inyong nga body is already affected. So if your body will try to heal that affected, no, ma-heal. But since ang inyong nga body naga-produce lang gid affected, they cannot, no, regenerate enough. Di ba? Kulang. So it will lead to your muscle fiber loss, leading to your muscle affectation, leading to your muscle weakness. Okay? So again, it's just a genetic mutation. Okay, the inheritance pattern of your muscular dystrophies. We talk about your DMD and your BMD, no? They are both X-linked inheritance. So basically, the affected chromosome is your sex chromosomes in a form of your X chromosome. Okay? Your DM1 or your dystrophic myopathies, it will be divided into two types. You have 1 and 2, depending on the affectation. And your facioscapulohumeral dystrophy, they are both, no, autosomal dominant. When we talk about autosomal dominant, ano siya? One parent is diagnosed with a condition, but, or even a carrier, and then eventually, one child will have the manifestation or will have the condition, since dominant ang gene affectation. About the autosomal recessive under your limb girdle muscular dystrophy, both of the parents are just a carrier. Kag magwa ang condition sa ilang son or daughter. Okay? So, that's it. But let's solve them one by one later. Here. Itaanon lang sa likod. Itaanon. Okay. Sige. X-linked inheritance. What do you think? Male, female. Sige. In humans, we only have pilang chromosomes. How many chromosomes do we have?
1 to 3 pair. 46.
Pila. Sa naging pretest ko, di ba?
46.
Pila? 46 in total. And we have 23 pairs. And, no, from 23 pairs, 22 pairs are considered your autosome. Okay, so wala siya biological chromosome. One pair is considered as your sex chromosome. So one pair lang guys ang sex chromosome ninyo, which is dua siya. If in total, which is your X, Y, X or Y, no? In a form of your female, obviously, no, female is XX chromosome, your male is XY. So, if we're talking about your X-linked inheritance, which is the most common type of inheritance pattern, one is a carrier. Okay? One is the carrier. And usually, the carrier is the mother. Okay? Kaya guys, sa X-linked inheritance, ang son is not a carrier, but the problematic itself, or diagnosed with a condition. Guys, when we talk about carrier, what do you think is a carrier? Ang gadala sa ano? Carrier, gadala sa ano? Gadala sa affected gene, but they don't have the manifestation of that condition. Okay? Though asymptomatic lang, but the gene itself is problematic. Okay? Or mutated ang iyang gene. So, if X-linked, so if X-linked inheritance, guys, no, if this is, if the mother is a carrier and the father is usually unaffected, if normal, malangidang na pangasawa or napamanaya. Can you explain this one? No. Pero familiarize lang kung paano siya mag-work? Okay. So, guys, usually, Diba, ang mother kag father, ang iyan na siya bataon nga gender is male kag female. Biological ha. Biological gender is male kag female. Or biological sex is male kag female lang gid. So, if amon siyang mother, no, na affected, kag this is the father, for example, nakapamana siya normal ang gidya nga gene. If ano na sila nga doa, ang result is could be in a form of girl or a male. So, if the female is XX and if the male is XY, obviously, ang Y, no, is i-get din nila ya kay father. Tanan nga Y. I-get ang Y is get na kay father. Isa lang ganing X sa female, sa male. So, ang X na din sa isa ka female is ang isa affected, ang isa is unaffected. So, the X nga makadto sa isa sa son nyo, no, obviously ang son is ang paon, the father is Y lang yun siya eh. So, for example, ang son eh, Y. Okay? Ang paon niya sa iyang mother is, it could be the affected nga X or it could be ang unaffected nga X. So, if nakuha niya ang affected nga X, most likely they will have the diagnosis. But if makuha niya became mother is unaffected nga F, usually they are not diagnosed with a condition. But the most common gid nga nakaget kay mother is the mutated gene. Okay? Again, most common lang siya sa male. But it doesn't necessarily nga if X-linked, the affected gid is male. Gets? Gets ba? Okay. Kay may ara gyapon chances nga ang son sang X-linked mutated gene wala naga-manifest sa condition. Okay? Kay duwa man ang X sang female. Ang isa is mutated, ang isa is normal. So the chances, the higher ng galing guys ang chances nga makadto sa mutated gene sa son. Okay? Sa female, usually they will get the X of the father. Or obviously, mag-get din na yung X ng father. No? Kaya hindi man tanan makuha ang X ng mother. Diba? Kaya hindi man produce ang mother siya iya lang yun na gene. Gets? It needs the sperm cell of a male in order to produce a daughter or a son. So, it could be na mag-get ya ang X nga affected or ang X nga unaffected. So what if nag-get ya ang X na affected? Under your X link, they will be the carrier. Gets? The affected lang gid nga manifestation is the son. Kaya isa lang gid ang iyang X. So if matagad na siya sa X nga affected or X mutated chromosome, most likely they will have a diagnosis. But sa daughter, if mag-get ya ang X na affected, they still have another X, which is abnormal. Okay? Nga get nila kay father. Gets ba? Gets? Okay. Okay, I think dili man sila ma-focus sa mga question. Since majority is homogeny siya yung iyang ideology. Okay. Your autosomal dominant naman. Affected individuals usually have an affected parent. Isa lang ka-affected parent will need sang mutated gene para makaproduce affected son or daughter. Both males and females can be affected equally. So it doesn't matter if male ka or it doesn't matter if female ka. Since autosomal ang affected. The chromosome is your autosomes na affected. Okay, we have again 22 pairs of autosomes. And we have 1 pair of sex chromosome. Sa inheritance, ang affected da is the 1 pair of sex chromosome. Since arada sa X kag Y. Sa autosomal, the affected nga chromosomes are the autosomes. Okay? So, i-search nyo kano si autosomes. A variant na siya sa chromosome that doesn't have biological chromosomes. Na hindi siya X ag Y ang iyang chromosomes. Okay? And here, sa autosomes, they uses naman niya allele. Allele is a version of your gene or a version of your chromosome. Diba? That's why we have a lot of versions. May XP something, XY something, no, may Q something, may 3.3, 2.1, 1 something at the end, no? Because they are the version of your autosomes. Or I mean, a version of your chromosome. Okay, sige. Here. What time na yun? Doon nakalugal. Okay. Dahil pa lang ha. Here, guys, no? For example, the A stands for allele, no? This is your allele. Ang use lang din ng allele is that the big letter A is an affected allele. Is affected allele. And the small letter A is the unaffected allele. So, one allele lang or one chromosome lang is needed again for the person to be diagnosed with a condition. Saan mo na ni siya? Again guys, this one it doesn't mean that this is a female ha or this is a male, no? Just a picture lang. Both of them might be affected, no? Pwede ang female maging affected or pwede ang male maging affected. But sa example is male ang affected. Okay? Kag hindi sex chromosomes ang female, isang male ang AA ha, this is allele. Okay, allele. Since the affected structure is the autosomes, not the sex chromosomes. Again, gets lang? Okay. So, if, no, mag-drawing kaliwat. So, if this is the affected nga parent, affected, and this is your unaffected parent. This one, mabata, iduwa niya siyang iyang allele. The affected allele and the normal allele. So, obviously, if this is unaffected, ang iyang allele or iyang version sa gene is unaffected. Okay? Unaffected. So, if magbata ni sila nga duwa, no, magbata ni sila nga duwa, it could be in a form of male or in a form of female. So, if this one, i-give yan sa isa is ang affected ya, or might be, ang mag-get sa isa ya, isang bata ya, is the affected. I mean, ang chances nga mag-get ha, no, 50% nga mag-get ang affected, 50% ang mag-get ang unaffected. Gets? And this one, no, sa unaffected nga parent, usually they will get the good gidya nga allele. So this one, small letter, and the unaffected, same nga unaffected. So this is the child, no, the child nga makaget sa unaffected, usually normal. And if makaget sila ganit sa affected lang, any chance nga makaget sila sa affected allele will be considered diagnosed with the condition. Gets? One allele lang ang needed for the patient or for the son or daughter to be diagnosed. They don't have the carrier. Again, they don't have the carrier in your autosomal dominant. Gets? Gets ba? Okay. Like here, sa X-linked, di ba? Even though kagina, ang female na bata, no, gingatagan siya affected or mutated gene, it doesn't mean nga maging ma-diagnose siya with a condition. If we're talking about X-linked, kaya again, gani ang female, duwang iyang na X chromosome. Ang isang nga X chromosome is still functional. Okay? Here naman, sa autosomal dominant, dominant siya is that it's because just one allele, no, will lead into the diagnosis of the condition. Gets? Na-gets na eh? Okay. And your Sino ni? Ray? Sabat ang tulog sa. And your autosomal dominant naman is that same lang yapon guys, autosomal dominant ay autosomal recessive. Both of the parents are the carrier. Okay, carrier lang, both parents. Wala siya yung obvious no nga manifestation or diagnosis. Carrier lang. Basically mutated lang ang ilang gene. But here guys, since both of the parents are mutated, so possible if ang duwa ka mutated, yun namin yun siya if may ari na lang. No. Tinugan pa. This one. No. This one. Guys, both of the parents are mutated. So most likely, ang isa ka-allele is affected, ang isa ka-allele is unaffected. Same man here. Ang isa ka-allele is affected, ang isa ka-allele is unaffected. No? Don't mind the AA something this one. So, if ang both kaging used to be legal sa autosomal recessive is ang small letter A is the affected or the small allele is affected. The big letter is the unaffected. But we will not use that one. Okay. we will use a different version. If both parents are the carrier, no, female or male pa nagyangkon, since both of them are affected, the affected chromosomes is at AA, no, AA. This is the affected, or this is might be affected because ila biking use is small letter A ang affected nila. Okay, this one is your affected, this one is your unaffected. So, they might lead to what? Magbata sila in a form of female and in a form of male. So here sa female, pwede siya maka-receive affected nga allele, kag pwede man siya maka-receive unaffected nga allele. Gets? No, sa female, so obviously, pwede yan man ma-receive ang sa parent. Pwede yan ma-receive ang affected allele, kag pwede yan ma-receive ang unaffected. Gets ba? So, if na-receive ya both, no, if na-receive sang bata, it could be a female, a son or a daughter, ang both, no, nga mutated gene from the parents, for example, duwagin ko, no, mutated gene ng parents ang nag-get ya, most likely they will have the diagnosis. Okay? Ang mutated gene ng father, kag ang mutated gene ng mother, nag-get na siya or present siya sa son or daughter, they will have the diagnosis. But, if they only get, no, one mutated gene from the mother or one mutated gene from the father, if not both, yes, they are just a carrier. And there is also a chance nga ang child is unaffected, knowing sa nga may gene pagyapon si father kag may gene pagyapon si mother nga both normal. Gets? Question? Ray? Good? So we're good with the etiology. Okay. Okay, let's talk about your machine. Etiyo pa lang ito sa tanan. I-discuss na pa ni. Guys, kung kuan na kadasing. We'll talk about Duchenne muscular dystrophy. This is an X-linked disorder. So, X-linked siya. Most likely, no, sa inyo pa lang magamiton nga epidemiology, the male is more affected than female. Basta ganit mga X-linked, male is way more pagid no. It's more affected than the females. Okay guys? So expect mga muda kay Duchenne kag kay Becker muscular dystrophy. Ang iyang epidemiology is that male is more affected than females since it follows the X-linked inheritance. Gets? Okay. But here, the specific chromosomal affectation is your X chromosome, short arm, 21 gene lupus. Okay? The P stands for short arm. Ano naman yung long arm? Q. Perfect. Yes. Long chromosomes or your short chromosomes? Yeah. The Q is long. So, guys, it doesn't mean nga the chromosome affected here is 21, ha? This is just a specific gene mutations or specific variant, but not exactly the chromosome 21, okay? It's just X chromosome, long arm, and short arm 21. The protein affected is your dystrophin. Dystrophin is needed or it's important for your cytoskeletal component. Cytoskeleton, if makadtagit kita sa physiology of your cell. Okay? It's part of your muscle cell. Or the cell of the muscle, see cytoskeleton. The cytoskeleton is part of your cytoplasm. Okay? Part of your cytoplasm. In here, sa normal cell lang normal development is part of the cytoplasm. But here, it's a component of your muscle cell membrane. Cell membrane. What is a cell membrane? Covering of the cell. It could be, yung name is cell membrane or plasma membrane. So, if part siya ko sa covering of the cell, component siya of the cytoskeleton, what's the function of your cell membrane?
Protects the
Protect the cell from outer environment.
They allow kung ano mga substances to go inside or to go outside. Since they are the barrier. If deficiency dystrophin, obviously this disrupts the membrane cytoskeleton, leading to instability, making it prone to your mechanical stresses. Knowing that the function of your cytoskeleton, no, is for what? The shaping of your cell, and it provides or it supports for it avoids mechanical or cell stresses. Okay? So if gina-avoid yung cell ang stresses around your cell, no, or mga problem, if for example if ma-collides, no, ang mga components within the cell, so obviously there will be your mechanical stresses leading to your muscle affectation, leading to your muscle weakness. If ma-continuously stress ang inyong cytoskeleton or ang inyong muscle, the muscle cannot adapt it, it will lead into your muscle weakness. Okay? Even as, if ma-continuous stress ang person, maano ka mo? Patulog. Mabuang. So, ganun, same naman siya gapon guys sa muscle. Okay? Gets ba? The affected protein is the dystrophin. No, the affected chromosome is your X chromosome. Specifically, short arm 21. Again, most common childhood muscular dystrophy, approximately 1:3. Male is affected than female. Genetic disorder, the etiology, caused by mutations in your Duchenne muscular dystrophy nga gene, which is, ano gani nga gene? Chromosome X, short arm 21. Inheritance, X-linked recessive. Just explain the X-linked recessive pattern. Pathophysiology. Again, a mutated gene. For example, a mutated X chromosome. Absent. It's absent. Okay? Absent or severely deficient dystrophy. So guys, if may affected ka mo or mutated gene ka mo, no, it might lead to an absent or severely deficient si dystrophin. Again, if deficient na si dystrophin, hindi ma-properly do ni cytoskeleton iya function, which is it avoids mechanical stresses in your muscle, leading to the loss of stability of your muscle fiber membrane, leading to repeated muscle injury or stresses, leading to your muscle weakness. Gets? So just familiarize this one. Usually, ang muna siya ang pathophysiology of your Becker muscular dystrophy. Gets? Clinical manifestation. The highlights lang here is at the onset, usually mas bata, 4 to 5 years of age. Manifestation, the common is that proximal weakness, no? Amo gini siyang iya nga inherent nga muscular pattern is proximal weakness. It could be the shoulder or your hip. If there is weakness of your pelvic musculature, they will have or probably positive of what signs? Gower sign. No, there will pelvic girdle muscle weakness, progressive difficulty getting up from the floor. So in Gower sign, usually what? Anong iyang process?
From floor.
Use hand to what?
To propel the body up.
Why? Why are they using their hands?
Hindi sila weak ilagwads. Basta weak.
Weak
Big
ilang
up pelvic girdle.
proximal na muscle.
Yeah, they cannot do the hip musculature, especially the hip extension. That's why they need to support the your hip extension and your knee extension. Okay? No, that's why kinahanglan nila support nila from their upper extremity. How about your calcidohypertrophy?
Dadako ilang strokes.
But that's pseudo. Nag-hypertrophy ang calf, but in that muscle. It's the fats or other connective tissue. Instead of muscle hypertrophy or increase, instead nga si muscle ma-increase ang iyang size, no, the other structures, no, the other connective tissues or the fats will fill in, no, the muscle. It's because gani ang muscle is affected. Gets? Ano pa? Some of them basic manifestation, just mention them. Basta the most important, si proximal weakness, si calcidohypertrophy, and your weakness, progressively, steadily. Again, myotonic dystrophies are progressive muscle weakness. A group of inheritance progressive muscle weakness. So, ga-progress ang muscle weakness. complications, your contracture, okay, and your scoliosis. That's it. We also need possible complications of your cardiac complications. It's because may function gyapon si dystrophin in your myocardium, okay, and your cardiac Purkinje fibers, and your pulmonary affectation. Usually secondary to your scoliosis lang, okay. If there is affectation of your rib malformation, or if there is rib malformation, sometimes nag-compress or nag-affected si lungs, leading to your pulmonary problem. Complications also, we have cognition and your behavioral. It's again, dystrophy is also present sa inyong brain, leading to your verbal and your neurological affectation. The arthropometric changes lang guys is usually short stature, slow linear growth, knowing that the onset of the disease is 4 to 5 years of age. Okay, 4 to 5 years of age. So in that age pa lang, diba, we are just still learning to walk or to do more functional, and gagrow ang aton nga bones and aton mga connective tissues. If the dystrophy is affected, your muscle is also affected. So most likely, there will be part of the reason why the patient is still short and problem with the overall appearance. And weight loss, this is usually due to loss of your self-feeding nature. Again, mga amo nga age, usually ginahungitan pa na, or they don't have the ability to independently feed, diba? So if they have problem with that, usually they may experience weight loss. And of course, because of muscle weakness na ganit, guys. Okay, if tatabi ang age na booker 6 years old, 5 years old, 7 years old, it's mainly because associated na siya with the muscle weakness. They cannot feed themselves independently, that's why weight loss. Gets? Medical assessment here, the average full-time wheelchair use is usually 7 to 13 years old if range lang. We can use the range lang. Immobilization can lead to some other complications, which is your contractures. Knowing, if mag-use ka na wheelchair, the position of your hip and knee is affected. Might lead to what? Flexor contracture. Your hip flexor and your knee flexor contracture. And diagnostic evaluation, well, we can use the creatine kinase. Useful screening test lang. No? It might be increase si creatine, or si creatine kinase, or ma-decrease siya. Full gene sequencing. This one is a standard. It's because dina-check niya ang gene mutation of the patient. Again, what's the affected chromosome? 21. Okay. Pharmacological management. Well, you can give medication in a form of your prednisone or your deflazacort. No, helps maintain strength lang of your muscle. And of course, physical therapy. Okay? This one is according to your DILISA, which you need to maintain the mobility of the patient in form of range of motion and the strength of the patient. Maintaining. Okay? Maintaining. We are here not to cure the disease, but to maintain the functionality of the patient, knowing that the pathophysiology of the disease is progressive in nature. Gets? Progressive, hindi na siya ma-cure. What we can do is to maintain the functionality of the patient. And of course, to prevent the further complications. Okay? Question? Question? Cesar, may question? Okay. How can you DDX the Duchenne to Becker muscular dystrophy? How? Since again, same naman sila dua. X-link. X-link man to. Diba? If si Duchenne, X-link, si Becker, X-link man. The affected structure, same ng Japon. Dystrophin. Here. O diba? Same lang din sila guys. Here. Si Duchenne is X-link. Si Becker is X-link. Si Gene is XP21 or chromosome X, short arm 21. No? And the affected protein or dystrophin. So, how will you DDX the Duchenne to Becker or Becker to Duchenne?
Si Duchenne wala ka dyan dystrophy.
Ha?
May bilin pag-gamay.
Ang age guro, sir.
Si Duchenne ba ang wala dystrophy?
Complete absence kinsa.
Si Becker may
Si
bilin.
Becker, yung partially.
Yes. But if we're talking about the dystrophin nga component, no? Ano pa? Another one. Ano? Si Duchenne ang completely absent. Si Becker ang may several or may present pang dystrophin. Limited dystrophin. That's why if we're talking about severity, Becker is much more better compared to your
Duchenne.
ha? Yeah, Becker is better.
Ay, correct.
Where did you get that? Try lang. Okay. And you're compared to your Duchenne. Okay. But, meron pagkikita another classification to differentiate them. It's the age of onset. Kaya nga, di ba, bako ging emphasize so gina, nga kay Duchenne is 4 to 5 years old, ang iyang onset, that's why it might lead to some neurological, no, mentally a problem, and with the physical characteristics, here naman, kay Becker, is that, again, similar to your Duchenne, an X-linked recessive disorder, similar pattern of your weakness, proximal muscle weakness compared to your distal muscle
Weakness.
wet. No? Similar sila guys, proximal muscle weakness. So manifestation, same gina sila. Okay? Less common lang, epidemiology, less common compared to your Duchenne, and X-linked yan siya gyapon. Abnormality of your gene location, no? Chromosome P21, coding for the protein dystrophy. And levels are usually 20 to 80% of the normal. So guys, present pa guys si dystrophy kay Becker. Kaso jutay lang. Okay? Instead of 100% dapat, they only have 20 to 80%. Clinical manifestation, similar as well. But, weakness pattern is less severe compared to your Duchenne. Positive gower sign, no? Positive pseudohypertrophy, and positive cardiac involvement. But here guys, presenting after 7 years of age. Ang iyang complications, two distinct patterns of progression, it's because the age of onset depende sa kay Duchenne, ay kay Becker. We have here 7, no? Nga iyang age of onset, or we have here 12 years old. Pwede pa siya in adolescence ng manifestation. So sa age pa lang, ma-differentiate na if Becker or Duchenne. If medyo bata-bata pa siya na-diagnose with Becker, usually have difficulty climbing stairs by the age of 20. No? Grabe severe ng iyang muscle weakness at the age of 20. But, if na-diagnose na siya, so usually 12 years old, na develop na get more ang functional ni patient, no, ang strength ni patient, ang ambulation ni patient, there is no problem climbing stairs at age of 20. Okay? Nagadepende man siya gyapon sa clinical manifestation ang age of onset. Same kay kay Duchenne. So here lang, the comparison nila nga duwa. The most, lang here nga comparison is your age of onset, no?
Wheelchair.
No, let's make much or the functionality. Of course, much more severe and progressive ang scoliosis, knowing nga mas bata pa siya na-develop. And your cognitive involvement, again, mas bata pag naka-diagnose kay Duchenne compared sa ila, nga na-develop na ang cognitive skills sa patient. And also your dystrophy here. Kay Duchenne is absent, no? Limited gid enough. Here is may pa siya 20 to 80% compared to normal. Okay? Facioscapulohumeral muscular dystrophy. From the name itself, guys, no? Fascio, scapulo, and humeral. So most likely, the patient may have a severe weakness of these structures or of these areas. Yung mga muscle involving of your face, of your scapula, and your humerus. Epidemiology, second most common inherited muscular dystrophy, third most common muscular dystrophy.
Dalog nito siya.
Here, guys, ang iyan nga gene, since this is autosomal dominant, right? Dominant. So, the autosomes is affected, the autosomes are affected, hindi na X chromosome ang gamiton, which is your, no, abnormal expression of VUX4 gene, no, this is a variant, no, or genetic variant of your autosomes, okay, which is located in your D4Z4 region of your chromosome 4. So this is your chromosome 4 is affected, okay. So before may mga expression pa siyang mga specific variant of your chromosomes, okay, but the main affected structure is your chromosome 4, okay.
Okay.
Okay. Sige. Clinical manifestation, guys. Usually, ano lang, let's say na lang, let's discuss, you should discuss na lang in general. There might be affectation of the muscles involving the face, the scapula, and the humerus. But guys, mind you, we have spared muscle. Your trapezius, your deltoids, and your forearm musculature. Okay? Diba? Obviously, gets video nga sa forearm musculature spared siya kay facioscapulohumeral lang siya. No? The forearm musculatures might be spared. But here your trapezius and deltoids ko no, spared ang ilang nature. I don't know why. Yung try ko man siya, I don't know why. Also, we have here your facial weakness and your cardiac conduction abnormalities. As well, guys, no, si patient may experience hearing loss and retinal telangiectasias. There is widening of your retina secondary to blood leakage of the retina. Okay? So, may problem na siya kay eyes, may problem pa siya kay hearing, and may muscle weakness pa si patient. And that's facioscapulohumeral muscular dystrophy. Again, gets man di guys, kay fascio, face ang affectation, so possibly, madamage nila si ears, si hearing, and your visual. Okay? Gets ba? So if you compare that to the discussions or to the conditions that we discussed earlier, wala to rin sila affectation sa face. So from a condition pa lang na mention na facial weakness, etc., hearing loss, something, that's your facioscapulohumeral muscular dystrophy. And also if you relate nyo lang guys sa chromosomal 4 yung affectation. Ala, kasi ka oras pa, 1 hour na.
Ano pa lang tapos na?
Kasi kung pala ni guys, okay lang. Mag-gets mo guro, di ba? Masali makamura independently. Okay. Okay, may klase pa ako next.
Hatag na natin.
Joke lang. May class pa ako 1 to 5. Reba class naman sang internship. Nga another variant. Another variant. Kaya intern sila another variant. Sila online. So here guys, diagnostic studies, the serum CK levels range from normal to moderately elevated. What do you think guys? Nga elevated per si creatine kinase. Creatine kinase, what the reason why? Nga usually basta affected structure, muscle, blood test kay patient elevated si creatine kinase. Why? Wala muscle movement.
Depende.
Pwede, pero...
Depende.
Nga pagka-blood testing nga nag-hire si creatine kinase.
Hindi normal.
Elevated siya. Diba, mag-blood testing ang blood gina-check. Present si creatine kinase kay blood. Nga dapat, aralan niya siya sa muscle. It's because kani guys, elevated na siya. Instead nga sa muscle lang siya located, nag-go out siya or nag-leakage siya sa blood. Leading to, pag blood testing nyo, nag-higher na si creatine kinase. Gets? Affected ng muscles eh. Affected ng muscle. So problem na si creatine kinase. No? If affected ng muscle, affected si creatine kinase, increase ng creatine kinase, instead nga sa muscle lang siya, component of a muscle, no? Part of a protein si creatine kinase ang muscle, very important for muscle contraction nga dapat aralan sa muscle. Pagka blood testing kay patient, positive si patient, increase creatine kinase sa blood. It's because too much creatine kinase sa muscle will lead into leakage of the creatine kinase going into the bloodstream, leading to positive si patient increased creatine kinase sa blood testing. Gets?
Yes, yes.
So, here also the most important is genetic testing lang. Pagka genetic testing, nag-balance na there is problem with the D4Z4 of your chromosome number 4. Okay? And you might check for audiology, cardiology, and ophthalmology. ENT na lang, guys. ENT na lang, no? Check na lang for the ENT for further referrals of the conditions. Okay? Or manifestation, rather. Limb girdle muscular dystrophy. Si MD. Si LGBT. Siya ni si limb girdle muscular dystrophy. Knowing, damo-damo ni siya variant. Okay? Damo-damo ni siya variant. Here, this is heterogeneous group of muscle disorder. Heterogeneous group of muscle disorder usually characterized by predominantly proximal distributions of limb girdle weakness. Again, proximal. Sino galing naman proximal muscle weakness?
Si
EMD, si Becker, kasi this one. Okay, ang weakness, though knowing, ano naman siya, Bing? Obvious naman siya, Bing, nga proximal din siya kay fascioscapulohumeral dystrophy, kaya fascio face. No? Scapulohumerus. So, mas proximal din siya, proximal din siya. General din siya nga proximal. Here naman is could be in shoulder girdle or your limb or pelvic girdle. Okay? Hindi naman tayo mag-last eh. Ano lang eh? Ihatag ko na lang bibigyan. Galing ko sa niya. Ihatag ko na lang bibigyan. Here, etiology guys of you. Nadugo pa nga. Wala. Wala lang gamay yung sura yun. Etiology. Pagtulog niya sa akin, gamay ng itsura yan. Oh. Sabi ko kapalagin siya. Etiology. Genes classified. It could be in a form of type 1 and type 2. Type 1 and type 2 maka-differentiate talaga type 1 kay type 2, it's because of the inheritance pattern. Okay? Inheritance pattern. The type 1 is usually autosomal dominant. The type 2 is autosomal recessive. Guys, the pathophysiology, same na ni guys. Correlate nyo lang problem with the gene leading to your muscle weakness. Same. But the gene mutation lang ang affected. Okay? Next, ano ba ako sa inyo? Actually, if ma-talk deeper kita each of the variant dapat kinahanglan tani i-discuss. No? Pero I don't know, ano nyo lang, i-bribe nyo lang inyong mga panel na too much din sa i-discuss. Wala lang wala gagawin. It's your part to study this one. Kailangan daw. But guys, even sa book, they don't explain each of these. I-check nyo si Delisa, i-check nyo kay Bradum, wala nilaging discuss each. I-discuss lang some, I think si sarcoglycotype si dysphrenin, pero the rest wala ni nila. And i-check nyo gani kay Sullivan, wala si Myopathies kay Sullivan. So duwa lang yung nga book din nga i-read. It could be kay Delisa or it could be kay Bradum. But you can check na naman sa internet directly. Malalaman, kung ako ang panel, pero hindi ko din pagdaloon. Pero kung depende sa panel. So, actually may panel na kamo, ara na. Pero I don't know yet. I don't know yet kung sino. Basta na-choose na mga panel. Ang panel? Hindi, lain naman. Lain naman ang mga variant of panel. I don't know if malain or bago. Pero mayroon ako kilala na panel siya. Si Moses Rubate. Hindi ko pwede ka panel niya. Ara na. Kaya ko ako mag-panel, pamangkotol. Tagito mo ka pamangkotol sa klase. Here, clinical manifestation. Muscle weakness, proximal in distribution. So, might be pelvic muscle weakness or your shoulder girdle muscle weakness. Positive siya, muscle atrophy. Obviously, it's because of prolonged muscle weakness. No? Positive gower sign man gyapon ang pseudo hypertrophy. It's because ganit proximal pelvic girdle nga affectation. Same gyapon nga process, no? The respiratory involvement and your cardiac involvement. Here, the complications, actually guys, they all share same complications eh. Contracture, o diba? Deformity, usually mga scoliosis, etc. etc. Ha? Pwede nyo lang isahon actually. Pwede nyo lang i-check, isahon. And your, ano yung pinaka-general, reduce activities of daily living. Reduce functionality, knowing na may muscle weakness na si patient. Diba? Perfect, no? Here, medical assessment.
CK naman.
Laboratory test. CK is elevated. Okay, in some forms. No? Electrodiagnostic studies, here, problem with the polyphasic motor units, with the muscle biopsy, evidence of muscle fiber degeneration. Okay? And your DNA testing kit, which is the mainstay of diagnosis of the condition. Again, usually the mainstay diagnosis sa dystrophies is your genetic testing. Okay? Genetic mutation testing. Ihapalo nyo lang kung anong affected structure sa genetic testing. Sa kay Becker, kay Duchenne, kay Fascio, kay Limb. Here, paso kay Limb, depende, damo-damo gani. Damo-damo sila ngani. It could be here in different form of glucose. No? Isa-isahon nyo kung gusto nyo. Okay? Basta mention nyo lang. Kung hindi nyo gusto pag isa-isahon, mention nyo lang ni Ari. Si Limb-Girdle Muscular Dystrophy type 1 nga may ara siya variant from A to E, type 2 from A to J. Pero hindi lang A to J. Kay ara pagin siya until your L, kay type 2. Okay? Okay? I-ask ko man yapon sila ang mga panel after lang ako. That's why may feedback na ko yung daan. Wala pa kami katok kay Sir Nick. May feedback na ko sa sa performance. Medical management, usually physical therapy lang. Go lang kamo gapon guys. We are not curing the disease, but we are maintaining the functionality of the patient at the same time preventing the complications. Ano mga complications? Contracture, deformities, and reduced activities of daily living in physical therapy setting. Okay? And your, okay na siya. Guys, may nag-bug lang na DR, it's myotonic dystrophy or your DM. DM. No, myotonic dystrophy lang. It's DM. Actually, si Dilisa, gayus lang siya guys, DM. DM lang yun, which is your dystrophic myopathy. Guys, DM stands for dystrophic myopathy. Okay, dystrophic myopathy. This is myotonic muscular dystrophy, aka dystrophia myotonica. So, alin na, mga basic side question. Easy side question. Okay? As two subtypes, we have type 1 and also type 2. So, may duwala kita nga may type sa si limb-girdle muscular dystrophy kag si myotonic dystrophy. Here, name ni myotonic dystrophy type 1 is si Steiner disease. Okay. Depende sa English. Wala mo ko reklamo.
Stein.
Pwede ba si Steiner? Depende kayo guys. Ako niya. Pamahigi kami dito. Kanya-kanya na to yan guys.
1, 2, 3.
So here guys, I want to classify lang the cause of the myotonic dystrophy. Medyo ma-confuse kayo, medyo lawing. Here ang cause there is unstable CTG, dinucleotide expansion of your dystrophia myotonica of the chromosome 19, long arm 13.3 variant. So, ang problem kay myotonic dystrophy is your chromosome 19. Ang problem kay type 2 is your chromosome 3. But may mga expansion pa na siya guys of your DNA. It could be CTG expansion. What does it mean we talk about CTG?
CCTG. Chromosome
2 growth. It's CCTG. thymine, and your guanine. We're talking about DNA. No? Cytosine, thymine, guanine nga expansion. Here, din naman cytosine, thymine, and your guanine. Okay? Na expansion. This is more on DNA na siya na expansion. Nagkanto na siya sa more specific. But guys, mind you, I want to, to general the affectation, your chromosome 3 and your chromosome 9. Okay? Amo lang yun na. Okay? DM1 is most common, adult, muscular dystrophy, and usually etiology is genetic lang. Autosomal dominant, okay? And caused by abnormal trinucleotide repeat expansion in baby in the form of CTG and your CCTG. Phenotype here, alright. Nakadepende siya guys, it's because the CTG repeats ko no kay DM1 is dapat ang normal 37. Kaso kay patient na diagnosed with DM1, iyang CTG is more than 50, which is positive gid siya of CTG expansion. Okay? And also type 2, CCTG repeat is normal, short usually less than 26. If more than 26 CCTG repeats is diagnosed a patient with your DM type 2. Gets? Alright. Here, the clinical manifestation. Are, ma-confuse. It's because, this is the only, or one of the distribution nga distal over proximal. Si DM type 1 ang may manifestation nga distal muscle weakness followed by proximal muscle weakness compared kay DM type 2 nga proximal muscle weakness. So tanan nga diagnosis under your myotonic dystrophy proximal except kay DM type 1. Okay? So guys, mga DDX, sila na lang guys, ari, mas easier. Tanan-tanan niya sila, ari, nga, i-DDX sa sila kag isa. If gusto niyo maging specific, kay LGM, kay DM, ang ilang mga variant, i-DDX niyo from each other. Since different sila mga manifestation. Different reason. Okay? Okay?
Okay, tara?
Medical assessment of your myotonic dystrophy here. If genetic testing lang, mabalaan natin ba genetic testing? Knowing kay DM1, there is expansion. There is expansion of your CTG. Kay DM2, there is expansion of your CCTG. Blood testing naman, usually elevated is CCK. Again, do back yapon sa reason why there is elevated CCK. And here, electromyography. And as well, electrocardiographic monitoring and referral to cardiology should be considered with this diagnosis. It's because there is cardiac affectation, okay? Associated with cardiac affectation, si myotonic dystrophy. PT assessment and your PT management. Sige. Sir, PT assessment and PT management for your DMI, dystrophic myopathies. Yes. MMT. So what do you think is the management? Energy conservation technique. How will you do that? More sets. Decrease ang iyang reps. Ano? Maka-rest siya in between.
Depende kung
Pwede. But, when we talk about conservation techniques, dapat there is enough time lang. Basta i-highlights lang that there is enough time for the patient to rest. Okay? It doesn't matter if damo repetition, it doesn't matter if damo siya sets. Basta naka-highlight si rest. Okay? Sige, another one. Ma'am, PT assessment and PT management. of the dystrophic myopathies. Tanan tong conditions ato di ba? Limb girth. Limb girth. Limb girth is directly for. No, that's for swelling. It should be muscle bulk test. Okay? So if to check lang if there is atrophy. What's your management? Strengthening. But what form of strengthening? You should be very specific with what form of strengthening. No. I mean the concept of strengthening.
Slow load and
Low to moderate resistance only. Okay? Since muscle weakness na ganit, we just need to maintain. We are not here to improve na gitgidya. Since amo na gina siya ang cause or ang diagnosis ni patient. Okay? Progressive in nature. Sige, sir. One, PT management and PT assessment.
Assessment, functional assessment, yeah. Mga outcome measure.
Outcome measure, just like what?
Theme.
What?
Theme.
Theme. Okay, safest.
Yes.
We did your PT management.
Management, of course, you do your fine motor task na mga movements. Especially may problem with the ADLs.
Like what?
Example, mag-brushing hair, combing, ECD.
That's very subjective, but that's correct. It depends gapon with the evaluation kay patient nyo. Correlated with the functional testing kay patient. Okay? And last one. Sir, PT assessment and PT management to your dystrophic myopathy. Gait assessment.
Respiratory problems.
Like in what form of gait training?
Kita ni kanin ulit.
Assistive devices.
Manong
What if the patient cannot use assistive devices?
Manong nagbaka.
Since diba some of them severely rhythmic initiation. Pwede, in a form sa lower extremity. But then, we can opt with if the patient cannot walk, we can opt to give na lang wheelchair. Okay? Because some of them may progress with ang diagnosis. Okay? We can correlate the gait deviation ng goro with the conservative management techniques. Okay? Nga, fewer steps lang and then rest. Kay, the muscle is easily fatigued sa diagnosis delay. Since the muscle itself is affected. Okay? Goods? Question?
Wala. Break.
Why na break, guys? 10 minutes. Ma-break pa? Yes. Charot lang. Break tayo 5 minutes.
5.
Yes. Gusto nyo break, guys? CR break?
Ay,
10:45, 10:45, 11. Makaya, dapat ang puso before.
Kaya to, no?
Kaya. Kaya ang takot.
guys, nagdala si Ray. Wow, thank you so much. Sir Lechon ka, sir.
Mag-lechon mang kami kagabi sa employees night.
Hindi mo ka to, rice ring. Charot.
Guys, 10 minutes break ka nga.
Uy, ikaw lang nagkutsara ba? Nagkutsara. Grabe ba? Pila na si Papa?
Tay! Tay, musta?
Hindi ko pa gamit.
Tay, musta, Tay?
Kaya.
Kailang.
Hoy! Tay, ano na ko? Pinaanan ako ni Mama.
Ano si
Napamaga. Nilaman ko. Kaya gapamangkot ba si Mama kay... Kasi kung nawala na ta matulugan to sa room. Ma. Ilo. Simbol ka. Kaya hindi ka, kay do, di ba, hindi ka man mag-ano sa, ang CR pala sa habitat. Nag-ano ko si mga base gusto mo singles lang. Sa? Sabi na ko nga, kaya ang CR naman ang problema na to. Kaya pa ni mama, ano na lang ko doon, PSO na lang pala. Okay lang si Mom. Tamba.
Valterize doon. Ano, Miss Ray, wala ano.
Wala mo po, ma. Charet.
It's my ribs.
Hello, ribs.
Ngit, okay. Gusto ko mangit-ngit.
Di are your ribs gusto mo?
Ari na lang, tira na lang mo padalas ka. Tawad ka. Tayo na answer na sa mga application. Chika, how? Ma'am. Sila bilang reply sa ako. Okay lang. Okay lang, si Jimmy nakamot. Subong birthday ni Ken? Karos niyo kamoton?
Hi Justin, sa Tuesday.
Birthday Justin. Birthday boy. Kulit siya na bigas.
Puta, kasi siya blood doon na. Puta, ginto. Ginireya ang baba. Ang balong sa
Kaya wala ko kasi gabi mo. Ganda mo. Yung magdala. Siya na.
Mas nakatuto ko na.
Mama, no ko na sa mga expenses.
Hindi ka kasabi, Lilo. Wala na.
Dua black bulat. Uy, sino to rin sa ilo? Wala ka sa IMH. Tarin doon kami ni pagtakulaan ka bula. Pwede lagin si Pia ko nakabak. Gahon si Jenny.
Sige na ba? Huwag yung midang.
Doon magpataka ko anong gusto mo.
Ano ko, tiga ulang. Kasi sa ako sa DM.
Yeah, huwag yun yan.
Tapos sabi. Ito kabuangon, ginasadaan.
Ray, Rila. Lunes ay wala na particular si Lunes. Bad dito wala. Bingo no bad.
Absent naman tayo.
Correct!
Ganito lang yan.
Ikilig na tayo.
First month, wala ako. Karma is a bitch.
May ba ano sige.
Ay, grabe, siya ako tako. Ay, wala ribs.
Si Ari dito sa ako na.
Wala ko dako. Paano? What makes you say that? Kaya, nasunto ko. Ay, ko.
Sakit pa siya, no?
Hugon, gutom. Pagkabugto ako, nagutom ko. Bato ko damog yung kaon ko. Ha? Dahil ko kaabot ko, tulugan ko na yun. Nag-late pa ko. Nagampang pa kami daw na yun, no? Nagampang kami yung nag-drive. Ako na kaunon, karon ni Rila. Ano yung tamba ko si mo? Wala na. Kalain ang epekto sa kape, no? Garibyos ka.
Oy! Good sana.
Tapos naka-ano display na yun. Okay, Jel.
Ikaw? Sino kaya?
Oo.
Supla.
Ano ba yung po? Mukha ng euro ka?
Kasi yun, Reyes.
When she flow, when she so ayoko na ito.
Yun lang ako dyan.
That's hard.
Uy, grabe sir. Bago lang ito kita na eh.
Mas basically lang.
So, dasigo mo lang ito.
5 minutes, babe.
Pwede lang na. Hindi niyo makuguro pag-feedback ka. Nilo inaway kung bakit.
Abal lang tagigil sir yan. Abalos.
Di ba?
Pinaka-highest.
Kung may 10 lang, 10 lang.
10 again.
At dahil lang sa face card, pwede.
Ay,
Sa appearance.
Pero,
Hindi.
minute to. Tapuhan lang siya.
Guys, mas ano, pag-exagal iyang regular, ay ang ano niya, ang variant 2 nga terms.
Now, para dire-diretso lang.
Hindi daw, wait lang. Ang inyong nga topic 1 is amputation, orthosis, prosthesis. Ang ila yung may fracture, amputation,
Ano, hindi lang
prosthesis, kag orthosis.
Sino lang ano kay curriculum?
Oo.
Sino ka ba yan?
Ang mga ano, oo.
Ang kailangan pa ilan?
O, wala kanya curriculum.
Curriculum.
May fracture, so ang PPT ta last time nga 125, na-add pa rin sa fracture, 106. Ha? Ang guro dapat. Ha? Kapag naman kubi nga, wala silang kapamati. Pero,
Online sila.
ha?
Online sila.
Kaya online man kami before. So, old curriculum is online.
Sa mo na nagaring parusa.
Oo. Ila, I think 2 months.
Sino ano yung ano?
Mas better ni siya, I think. Kay ang inyo nga topic is naka-divide. Ang ila nga topic is hindi siya compressed, but naka-damo. So ang inyo nga, di ba, i-revan yun is 3 lang ang topic. Ila i-topic is 6 topics.
Ato?
Oo. So,
Ano ka niya ato?
ang ila i-discuss or ang ila need is
Gusto ko cake.
ang inyo nga Reva 2 kag Reva 3 nyo, ila na siya Reva 2 pa lang. Ang topic nyo sa Reva 2 ne, nga 3, tapos ang Reva 3 nyo nga 3, ila na Reva 2.
Pero daw mo, nagaling mo.
Damo, gid siya. Ibot ko gani. Aman di sa muna sa amin. Pero naman daw, mabibigay pang suicide na topic. Aring mayo pa, din suicide ko ni. Kaya, I mean, daw ka itsura, daw ka sounds like basic. Pero pwede naman chichian. Pero, wala ko siya gintunan. That's why gintunan ko pa rin
Anong
siya.
namin yung suicide sa concert? Sa tanan?
Sa tanan.
Ako na lang po. Ako na lang bigti.
Feel ko ang i-ano niya nga is suicide. Doon ka wala man.
Wow.
Yeah.
Kay ano, kay wala nakabalo kung anong inyong subtopic.
Kasi ka tuloy.
Wala nakabalo kung anong subtopics. Kung ano bala, kung sino ang part, for example, hindi man guro sa isa ka topic
Di ba paring?
type of the 9 na si amputation, orthosis, kag prosthesis.
Ano ko tinagul?
So wala nakabalo kung anong suicide niyo.
Nag-eat sila
Feel
sa
nyo,
likod.
i-open na out si orthosis, prosthesis, kag amputation.
Guys.
Really, hindi tayo na kaya sa isang discussion niya.
Nag-isog na ilang ano.
Nag-Spanish na. Ay, espresso.
Mitang ko.
Kung nabalaan na ang basics sa orthocross, tapos lang ang orthocross tani, pwede na siya makonect-connect. Tapos ang amputation.
Oh, yan na.
Tapos pinaka-depende na sa name.
Mga...
Guys, tunaan nyo, gid niyo sila ha. dapat subong, dapat 100% mapasar. Kaya na 100% mapasar yan. Ang balo, kapabuday-budayan pag isubong.
Hindi mo sure.
Oo, may mga names ko isa. Si Casey. Si Ray Cesar.
Kahingalo.
Ibdaan yung side question.
Basic eh.
Saan ulit?
Adjustment.
Si Sir Gal. Gal dito. Saan mo si
Ha?
Sir Ray sa iyo?
Hindi ka na lang tao.
Ara na sila.
Sir Gal. Kabalagin niya si Sir Gal. Kasi Sir Chino sa iyo.
Nagalaw ko si Kenneth Shoot.
Oo. Okay.
Sa copy. Basta gisendan ko si Dan last time.
I love it.
Sino nagpanan kay Daniela? Kamusta siya? Di ba kanyo sabi please? Masakit lang.
Kung Angel, kasi
Galing,
dito
no?
mo sa Manila.
Dali mapatiyan nga friend kami.
Ay!
Ano ka? Devil.
Wow! Di pwede kay both as face card.
Ay, lalasa.
Namungolo ko.
Kaya wala man bilaw ay sa TV guys.
Correct.
Batasan na yun.
Patasan lang yun.
Damo.
Kita mo sana pag-abot estudyante.
Seryo?
Di ba pod kami
Pag kami
po
serious.
last time sa
Ah.
series.
Ay,
Pod kami kita sa guys at kita Hadis ko nag-ulit ko. So pala kayo po ng kuhan. Nag-ask lang niya ang conductor kung
Taga-DN.
While nag-ask kung student or ano. Di wala mo kayo nag-ambas sir regular or something. Nag-ask lang ko from sa location ko. Then tag sa ako niya is estudyante nga price. Same kami nga doa.
Ako tipid-tipid ka pa.
Estudyante ka na ginapit na per me.
Ano to ako?
grabe.
Ginaas pa. Duway naman ginaas. Diba sa sila?
Ginaas?
Naas na.
Ginayang mo.
Ako ma'am, bagi ko nga estudyante.
Hindi mo mas na kwarta. Nagkada ko, because I think the 40 pesos git ang difference sa regular. Kag sa... No, 40 to 30 difference. 30.
Wala, NB. Di na.
Sige na guys. Sinasigaw ko lang niya. Legit. Okay lang.
Legit wax.
Sabag. Sige guys, thank you guys. So here, myopathies. Guys, actually, myopathies is a group of primary affecting skeletal muscles. Basta, myopathies is a group of diseases that affects the muscle. So obviously, mas, ano pa gini siya, mas general sa pinaka-general. Si myopathies. Because, si myopathic dystrophy, naging discuss natin earlier, is still part of your myopathies. Kasi sa structure lang din naging sense sa akon is yung una si hereditary ay si dystrophic myopathy. So yung discussion sa una. But the mother of all the mothers,
The mother of
si mama.
Mama.
Si myopathies.
siya.
Si myopathies. So, this is separated again into two categories. Okay? So, pwede nyo guys, ang intro nyo sa tanan, sa neuromuscular diseases, or sa neuromuscular disease, ang pang-intro nyo. Okay? If magka-spread, nakamukhang nagabutan nyo ni, pang-intro nyo si neuromuscular disease and your myopathy. It's because si myopathy is divided into two types. We have acquired and hereditary. Acquired is naga-develop or diagnose ang patient. It's because with the exposure of some certain chemicals or whatsoever. When about hereditary, it's present from your mother or father or from your grandparents or from ninong-ninuan. Okay? So, are, di ba? Kaginaging discuss natin si muscular dystrophies. Part na sila guys sa hereditary myopathies. Okay? So dapat amo siya dapat ang giuna ta explain kagina gid ang pinakauna nga discussion. Kaso gi follow ko lang kung anong structure nga ginsay. Again, part ni sila si Duchenne, si Becker, si Myotonic, si Fascio, si Limb-Girdle, part ni sila gyapon sa myopathies under hereditary myopathies. I-discuss natin kay hereditary, si congenital myopathies, si metabolic myopathies, si inflammatory myopathies, and then your endocrine myopathies. So, let's talk them each. Sige, i-ano tayo, isang konta.
Subang ko ba?
So, under your myopathies, do you have notes guys? Under kay myopathies, kung ano na yung code? Okay. Ano mga conditions under the myopathies?
Tanong ko din.
Ang need natin i-discuss.
Tuyog.
We have congenital,
Color yellow.
we have your inflammatory, we have here your
Diabetic.
metabolic,
Ay po, di na lang.
we have here your endocrine, and then your drug induce. Lukas, pwede ka induce. Hindi tao, just kidding guys. So, here, we talk about congenital myopathies. Congenital, part siya sang hereditary. Used for group of heterogeneous autosomal recessive disorder. So, autosomal ang iya nga etiology. Again, present as hypotonia in infancy, can clearly be localized to muscle and has weakness that is non-progressive or slowly progressive. Compare kagina kay muscular dystrophies, they are all progressive in nature. Here, kay congenital myopathies, it might be non-progressive or slowly progressive. Rare, usually genetic in nature, and usually present in infancy or childhood. So, from the name itself, congenital. Amo na siya. Etiology nyo, see? Congenital in nature. It's because there is genetic mutations affecting the proteins for muscle fiber structures. Protein man yapon. We don't know the specific protein, basta it's affecting the protein. Since it's gaka-occur pa lang siya yapon niya guys. Gaka-occur siya guys, congenitally. Okay? It could be autosomal dominant or autosomal recessive since genetic mutation siya.
Nag-breaks.
Yeah, ang sense of smell ko. So here guys, the general manifestation of your congenital myopathies are proximal muscle weakness is more affected than distal distal muscle weakness. Are, kagina, ano nga condition ang only naga-manifest proxima ay distal muscle weakness over
DM1.
Sorry lang kita. Okay, tapos na. Part of your congenital myopathies, we have
Ano, matay siya?
huli na. So we have here your central core myopathies, your nemaline myopathy, and your centronuclear myopathy. Let's talk them each. Central core myopathy. Actually guys, here, a rare predominantly autosomal dominant disorder, more severe phenotype, associated with autosomal recessive. This is autosomal recessive in nature. See, central core myopathy. Typically, the affected chromosome is your ryanodine receptor gene on chromosome 19. So, duwa na ka chromosome 19 ang affected. Kagina kay chromosome 19 sa kay DM2 or DM1? DM1. No? Here, kay congenital is also chromosome 19. But nagadepende lang sa variant of the chromosome. Okay? Clinical manifestation, a floppy infant with hypotonia and proximal weakness. So usually guys, we talk about myopathies, the most common manifestation is your hypotonia. Okay? Hypotonia. Okay? Under your myopathies na manifestation. Most common. Blood testing, usually CK is normal to mildly elevated. Same lang yapon since muscle affectation. Okay? Too much CK sa blood ay sa muscle will leak out into the blood. That's why if you check the blood test kay patient, creatine kinase is higher. We have also here guys the genetic testing. of the R1 gene of your chromosome 19. Okay? This is your ryanodine receptor 1. Okay? Okay, your Nemaline myopathy is a rare myopathy with 6 different clinical phenotypes. May 6 different clinical phenotypes. So may mga clinical phenotypes pag siya, pero wala ko na siyang i-include here. Okay? Kaya actually na-include lang di ba is congenital myopathies. Wala siya na-mention kung ano ang each. So ging-add ko lang ang 3 gyapon, which is kagina si central core followed by your Nemaline myopathy. This one associated with autosomal dominant. If si central core is autosomal recessive, si another variant ng Nemaline myopathy is autosomal dominant in nature. So, i-associate naman sa gapon sa yang etiology with is autosomal dominant. So here guys, Nemaline myopathy comes from the Greek word nema, meaning thread. It's because the muscle fiber na makita nyo kay patient here is a multiple thread-like inclusions on Gomori trichrome staining. So, ang iyang gene here is positive thread-like. From the name itself nga Nemaline, nema from the Greek word is equals to thread or thread. Kaya makita sa iyang muscle biopsy is multiple thread-like. Okay? So, mo naman siya ang most important kay Nemaline ang muscle biopsy. Of course, genetic testing usually associated from what specific nga chromosomal or the affectation. So it could be genes encoding your actin alpha 1, your nebulin on your tropomyosin. So amon siya mga variants, some of the variants na possible affectation. Mas more confusing si congenital. And also, lastly, your centronuclear myotubular myopathy. Rare myopathy inherited both in autosomal dominant and autosomal recessive. Si kagina ang una, sino to gani? Si Nemaline is autosomal dominant. Si central core is autosomal recessive. Si centronuclear is both autosomal dominant and autosomal recessive. So, there is mutations of your DNM2 gene have been related to dominant types of centronuclear myopathy. So another variant naman sa gene ang affected, which is the DNM2. Okay? So another autosomes na affectation. Okay? The autosomes, not the biological sex na chromosome, but the autosome. Okay? Since autosomal in nature ang iya inheritance. Gets? Here, a common manifestation na galing kay myopathy is your hypotonia. Present si hypotonia, including the proximal weakness. Okay? Sige. Medical testing, still, your CK is normal to mildly elevated. The most important here is the muscle biopsy and your genetic testing. Kay genetic testing, mag-check ang types of mutations. That's it. Okay? Or kung gusto nyo guys, you can explain the congenital myopathies in general. And then mention na lang si types, which is ang tatlo. Even the definition lang, just define the definition of each subtypes of congenital myopathies. And then explain nyo lang siya in general. Okay? Here, we have medical assessment and then medical management. Actually guys, sa medical assessment, kag medical management of your congenital myopathies, pwede din mo siya gapon matchechian. Okay? Basta nakabalo lang ka mo ang inheritance pattern and sensitive medication, especially for muscle weakness or hypotonia, for pain, if the patient may manifest pain. Amo lang siya guys, if hindi nyo gusto i-explain ang each part of your congenital myopathies, pwede lang i-discuss in general. The definition of your congenital myopathies, the etiology, the epidem, and the definition lang, even this is the definition of the conditions na i-discuss natin. Pwede nyo lang i-explain si central core myopathy. This is a condition, a type of congenital myopathy that is usually autosomal recessive in nature. Okay na, bisa subagani pa sila duwa. Followed by your Nemaline myopathy. This is a rare congenital myopathy that's usually associated with autosomal dominant inheritance. And lastly, your Centronuclear, which is both in autosomal dominant or autosomal recessive. Diba, na-explain nyo na ang types, na-explain nyo pa ang iyang etiology. Okay? If ang epidemiology ay rare condition under your myopathies. That's it. Your medical assessment, kag medical management, guys, you can, generalize. Most common, blood test. Ano gina-check sa blood test? CK. Both of them might be normal to slightly elevated. Also, muscle biopsy. It could be associated in what type of your conditions under your congenital. Diba? For example, in your nemaline, if makita sa muscle biopsy, there is positive multiple thread-like. Since that is the way to diagnose your nemaline myopathy. Also, your genetic testing. Dahil na ma-check if what chromosomal in affectation. Your physical therapy, obviously, generally no universal curative treatment. Again, we don't treat or we don't cure the disease. We are here to maintain the functionality and to prevent the complications. Nutrition, swallowing, for feeding, for nutritional deficiency of the patient, if there is nutritional deficiency. Musculoskeletal, obviously, as range of motion, stretching, strengthening, mobility, and gait. Basta ganit guys, all of the myopathies and dystrophies again discussed naton, we can only give low to moderate exercises, knowing that the affected structure is your muscle. Okay? Ang muscle affected na. I-push nyo pagid, i-give nyo pagid a lot of stress, obviously mapatig ang muscle. It might lead to worsening of the symptoms. Okay? Okay? Perfect. Inflammatory myopathies. Amoy siya may side types, gina siya according sa Giesen. Inflammatory myopathies, hallmark of the inflammatory myopathy is predominance of inflammatory cells on muscle biopsy. From the name itself, you can use na the muscle biopsy sa inyong medical assessment. Basta there is a presence of inflammatory cells. These three types of your inflammatory myopathies, your DM, dermatomyositis, your PM, polymyositis, and your inclusion, body myositis, they all share similarities lang. The difference is that the age of onset lang gyapon. Okay? So here guys, sa inflammatory myopathies ko they are discouraged from physical activity due to fear of exacerbating muscle inflammation. But that is more na gid siya if you're providing a lot of physical activity. Again, low to moderate physical activity lang ang mag-give natin kay patient. Since ang goal natin is not to cure, but to maintain the functionality. Okay? Dermatomyositis. Inflammatory myopathy that may affect adults and children with cutaneous involvement. This is adult and children. Basta dermatomyositis, there is inflammatory myopathy lang with involvement of your cutaneous or your skin. So manifestation here, still a proximal muscle weakness, but there is heliotrope rash, your Gottron papules, and your nail fold telangiectasia. So this is usually associated with your cutaneous affectation or skin affectation. Okay? Basta ganyan may kasi mention nyo lang, dermatomyositis, derma is skin. So obviously there is inflammation or this part of the inflammatory myopathies that is related with cutaneous or skin problem. Okay? Ikot lang, don't forget, say heliotrope rash, which is a villaceous scaling rash around the eyelids with a periorbital edema. Okay? Although, bago picture out nyo na siya. And your Gottron papules, and your nail fold telangiectasias. And also some of the musculoskeletal manifestations lang. Myalgias, that's just muscle pain. You can include muscle atrophy or hypotonia. Ano pa ba? Muscle weakness. But this is in proximal yapon, ha? Proximal. Medical assessment, here same ng yapon, CK is elevated, electromyography, muscle biopsy, and malignancy screening, knowing that is usually associated with malignancy, especially your skin cancer. Okay? Pharmacological management typically involves immunosuppression.
Suppression.
suppression. So, ay masagay pangilan si klase ko, nagkakapitla, lagi kuya guys. I don't know, pila na yung time na to. O diba? Para may rest ko tani in between. So here guys, no, the first line of treatment, dugi-dugayon ko ni Karol. The first line of treatment guys is your corticosteroid. Here, this is pharmacological management. Again, since limited na madusang physical therapy, it's because gaka-worsen ang inflammatory kay patient, ang inflammation kay patient. Polymyositis. Poly, inflammatory myopathy of individuals over 20 years old. Ato ya adolescents or childhood or child here usually over 20 years of age. Rare disease, also there is proximal limb weakness associated, again, sinong yapon, there is myalgia, muscle tenderness, cardiac involvement, and there is lung disease and malignancy. If dermatomyositis associated with skin problem, are usually involvement of your cardiac and your lungs with some of malignancy. Okay? Medical assessment, same. Okay? And your pharmacological management. Like, same lang siya gapon pharmacological management, guys. Since under lamas na gapon of your inflammatory myopathies. Ang differ lang is that the age of onset. Okay? An inclusion body myositis predominantly affects over age of 30. From childhood to adolescence to 20 to 30. Okay? Most common occur at the age of 50. Okay? The age of onset kaya is 30, but most common sa at the age of 50. Here, asymmetrical weakness, including finger flexors. Here, there's unique manifestation. It's because ang iyang weakness is finger flexor lang, which is intrinsic positive nga position. And also, duwa lang kitang i-mention nga iyang weakness we have finger flexor weakness and your knee extensor weakness. And there is distal limb weakness resulting in your foot drop. So, duwa ng aton nga distal. Sino nga ganang isang ina?
Game 1.
And your inclusion body myositis, duwa lang siya. But here guys, this is not exactly distal. It's because the most affected when siya gyapon is your finger flexors and your knee extensors. Medical assessment, CK, EMG, and your muscle biopsy. There is no pharmacological interventions have been found under your inclusion body myositis. Okay? Wala siya pharmacological management. Wala siya bulong. Okay? So we can opt lang yapon. If there is no pharmacological management, we can do exercises kay patient, but with low to moderate exercise only. We're done with your inflammatory, metabolic myopathies. Lasing na lang nila. Wala. Magpuan ka pa dito. Sige. Guys, your metabolic myopathies, a group of muscle disorders caused by abnormalities in the production of the utilization of your energy within skeletal muscle. So basically, they're just problem with the utilization of energy within your skeletal muscle. Since the muscle is affected. Patient.
Ano rin sa man?
Nakita ko nga. So guys, here, patient with problem in your glycogen, no, your lipid and your purine metabolism is usually the exercise intolerance or exertional muscle pain. There is a problem kay glycogen, kay lipid, kay purine metabolism leading to affectation of your exercise intolerance and muscle pain. So since guys, metabolic, mga metabolic properties, glycogen, mga lipid, this might lead to exercise intolerance and exertional muscle pain. May no be fixed weakness. Ang metabolic myopathies guys, no fixed weakness. Basically, muscle weakness lang siya gyapon in general. fatigue, myalgia, and muscle stiffness. From that, there is muscle intolerance related with muscle pain. So myalgia is present. If exercise is intense, patient may note a brownish red color of the urine from your myoglobinuria that is due to your rhabdomyolysis. So, under your metabolic myopathies, we have your acid maltase deficiency, which is a rare autosomal recessive disorder caused by glycogen metabolism, which affecting your lysosome maltase pathway. Lysosome. What is the importance of your lysosome?
Breaking down
Sakto na.
sang
Breaking down some
Protein.
mga
proteins.
mga
Or?
trash, mga
They usually kills
kills.
those mga old problematic compounds within
Mga trash.
your cells.
Siya ang
Okay?
garbage bag.
Gina-crash,
Yeah.
ginasumbag, gina-eat. Sila na ila na work sa cell. They are called your scavenger cells or your suicidal bug. It's because if may makita sila nga problem kay cell, silang ginapatay nila or gina-eat nila. That's why gakapatay man sila. They are just there to fight the problem and to die.
Oh.
Okay? Just like us. Just like us.
Fight the problem and we die.
Diba? Fight lang sa problem and eventually,
We die.
we die.
Amen. Oh, wait.
That's life. Epidemiology, this is rare and male and female is both affected. Are both affected.
Dalian na.
Okay, your clinical manifestation, it could be, we have types. Infantile in form, late onset, and other symptoms. So includes cardiomegaly, hepatomegaly, hypotonia, gyapon, and later onset is usually associated with slowly progressive proximal weakness than distal. So same. Medical assessment, CK levels vary from normal to 15 times than normal in late onset. Okay? Usually, positive muscle vacuoles containing the glycogen, since this is associated with metabolic myopathies or metabolic.
Metabolismo.
Metabolic properties, okay? Kay genetic testing lang guys, since it is associated galing kay autosomal recessive. The acid maltase deficiency is an autosomal recessive. So you might check for genetic testing lang. Medical management represents one and only handful of potential treatable neuromuscular disorders at this time. You can give recombinant human GA enzyme replacement. So basically, you just need to replace the affected enzyme kay acid maltase deficiency. Okay? Kung anong affected na siyang metabolic properties, amo naman siya gapo nang i-replace. Other one is your myophosphorylase deficiency. The other name, si McArdle disease or glycogen storage disease type 5. Still, a rare autosomal recessive disorder since your metabolic myopathies is under hereditary in nature. Diba? Hereditary siya in nature. Here. So usually, your congenital and metabolic myopathies, they're all related to hereditary. But all of your metabolic myopathies is usually associated with autosomal recessive. Okay? Autosomal recessive naman siya.
Dawit pa.
Why not?
Next na.
So guys, what do we mean when we say about second wind phenomenon? Sige. Second wind phenomenon.
Second win?
Second win, second wine.
Paano na ba? Here. So, di ba, may experience a second wind phenomenon in which muscle stiffness, painful cramps, and exercise tolerance improve after a rest. So, if the patient, kung guys, nag-exercise mo kay patient under your metabolic myopathies, no? If nag-exercise mo, nag-exercise kay patient, the patient may experience fatigue, or muscle cramps, or muscle stiffness. What you can do is to let the patient rest lang. After rest, kag nadula ang fatigue or the patient's ang signs and symptoms ni patient, that is what we call your second wind phenomenon. Okay? That's why conservative energy management is very important sa kay myopathies and your dystrophies. Okay? No proven treatment for the McArdle disease, but we can give nutritional management and your physical therapy lang. Which is, example, aerobic exercise. And also your endocrine myopathies. Usually guys, kay endocrine myopathies, the example ko lang din your thyroid, which is the most common affected. Required myopathies occur when hormonal abnormalities alter muscle metabolism, your protein synthesis, and your muscle function. So, occur at any age depending on the underlying endocrine disorder, usually associated with other endocrine disorder. Look, a complication na siya of the other endocrine disorder since this fall under acquired myopathy. Okay? Si patient may an diagnosis of an endocrine disorder and naka-acquire sila sa endocrine myopathies. We have here your thyroid disorder, which is a common muscular dysfunction associated with hypothyroidism and hyperthyroidism. If the patient is diagnosed with hyperthyroidism, if associated na siya kay myopathy, this is what we call our thyrotoxic myopathy. Thyrotoxic myopathy, it's because there is a lot or increased amount of your thyroid or hormones. Okay, your thyroid hormones. It could be your T3, T4 nga hormones. Okay? And also your hypothyroidism, if correlated siya with the endocrine myopathy, this is what we call hypothyroid myopathy. Thyrotoxic myopathy, or there is increase lang of your thyroid hormones. This is hyperthyroidism. Etiology, reason. Pathophysiology, because of the hyperthyroidism, there is excess or increased thyroid hormones leading to increased protein catabolism, leading to your altered muscle metabolism, leading to your muscle wasting and your weakness. So metabolic. So this is endocrine in nature, usually associated with your hyperthyroidism. Here, same, proximal muscle weakness. Associated nyo lang kung anong na-lead, which is muscle wasting, muscle cramps, and fatigue. Basta related with the muscle. Pwede man myalgia, no? Etc. etc. Okay? Hypothyroid myopathy, basically this is nag-decrease lang ang thyroid hormone, leading to altered muscle energy metabolism, muscles weakness or dysfunction, leading to weakness, stiffness, and your myalgia. Here, proximal weakness. So you can just generalize them, guys, under your endocrine myopathy. No, proximal muscle weakness naman sila gyapon. Muscle pain, positive and muscle stiffness, and muscle cramps. Different lang ilang etiology or the reason why there is endocrine myopathy, but the manifestation, they just share similar manifestation. Okay? Here guys, no, for the medical assessment, EDDX na lang sila nga duwa, ha? Hypothyroid and hyperthyroid, your muscle biopsy kay hypothyroid kay hyperthyroid. Here kay medical management guys, since this is acquired, you need to treat the underlying condition. Okay? The main reason why the patient is diagnosed with acquired endocrine myopathies. No? Correction of thyroid level reported to normalized strength within 3 months for hypothyroidism and 3.5 days or a half months for hyperthyroidism. Thyroid replacement therapy. If nag-increase, no, if nag-increase the thyroid hormone, what you can do is to give therapy para ma-decrease. If nag-decrease the thyroid hormone, what you can do is to give more supplements to increase the thyroid hormones. So, if ma-treat nyo na ang underlying conditions, mag-go back naman guys ang function or ang pattern or ang flow of your hormones relating to your muscle, leading to the solution for endocrine myopathy. And also, we can do lang physical therapy since there is muscle weakness. Okay?
Okay.
Hence, it's muscle pain and inflammation. Okay, perfect.
Kapsa? Oh.
We also have
Last.
your drug-induced myopathies.
Last.
Hindi pa may rehabilitation protocol pa kita. Guys, kay drug-induced ang bako na si Daxi na tuwidugay niya gyapon niya.
Gusto lang ka na.
70 out of 91. Dasig na namin. Guys, dasig na sigol. Mani si ano ha? Si drug-induced myopathies.
Times 3 sir.
When we talk about drug-induced myopathies, this is usually associated with medications and toxins or toxics nga ano naton sa aton body, okay? Nga gina-let to our body. This is also acquired myopathies, no? Because of the exposure of the medications, because of the exposure of the toxin, we are diagnosed with your drug-induced myopathies. It could be in a form of steroid myopathy, your medication-associated myopathies, and your alcohol-related myopathies. Sige. Steroid lang. Maybe because of the exposure, no? Chronic steroid use, particularly in higher doses, it might lead to your steroid myopathy, which is mild generalized weakness, typically sparing neck flexors associated with steroid exposure. Basta ganun guys, the reason why we have steroid myopathy is because of the exposure of your steroid. Basta ang mga pathophysiology ni guys, ang drug-induced myopathies, they are all not properly explained. So, let's say na lang na idiopathic in nature. Since wala siya pa na properly explained in detail. This is according to book na galing guys. This is from, duwa naman akong source si Bradum kay Dilesa. Kung why na na-explain properly, so most likely wala pa rin sa research about it. So, let's say it's idiopathic in nature. Okay? Clinical manifestation, same. Proximal muscle weakness. Okay? Proximal muscle weakness. Medical management, decreasing or discontinuing the corticosteroids. Basta guys, mga acquired, what we can do is to treat the underlying causes. Okay? Kung anong nag-cause leading to your myopathies, amo na siya. If ma-treat nyo to, kung anong nag-cause, usually, gakadula naman si myopathies nga acquired myopathies. And your medication-associated myopathies, guys, this is considered drug or toxic-induced myopathies with manifestation of muscle pain and weakness. Usually guys, common medications that might cause myopathies is your cholesterol and your lipid lipid lowering agents. Na mga common siyang medication yung makalead to your drug-induced myopathies. I don't really like guys, sabi na dali-dali ko ay my brain is not functioning very well. Okay? So here guys,
Paano non-functioning ko?
okay na face card yung tagapon guys. So guys here, we talk about the pathophysiology of your drug-induced myopathies is that exact mechanism still gyapon not properly explained. So idiopathic siya in nature. Possible due to statin exposure that may lead to altered muscle performance leading to your muscle weakness. That's it. Okay? If being discussed lang nina, it's statin, cholesterol na management or medication. And clinical manifestation, same yapon guys. Proximal muscle weakness with myalgia, myositis. Your complications, we have your rhabdomyolysis and your necrotizing myopathy. Guys, what do you mean about rhabdomyolysis?
Pain.
Those very severe, muscle problem that's usually associated with or might lead to your kidney problem.
Yes.
Since there is already elevated creatine kinase or CK, amo na siya guys. Necrotizing myopathy from the word itself, necrotizing, okay? This is by muscle fiber necrosis. Basically, ang muscle fiber na deads, leading to your complication of your necrotizing myopathy. Okay?
Nilabay ko.
Laboratory test lang guys is
Hindi naman dala.
blood test. No? Check lang for elevated CK. Okay? Okay. Medical management, use a lower doses lang guys if we're talking about medications, especially if mga anti-cholesterol, no, if mga statins medication, since there's anti-cholesterol, you can do is to give smaller doses lang. In order for that, hindi ma-overdose the patient, not to damage your muscle cell. Okay? And lastly, we have your drug-induced alcohol-related myopathy. So we have here, it could be acquired because of the exposure to your alcohol. We have here your chronic alcoholic myopathy and your wait lang, your acute alcoholic myopathy. So guys, which do you think is more severe and more complicated? Is it chronic or acquired? Ginadugay ko na magamba, para hindi na ako magpitla,
Cute.
Why do you think it's acute and why do you think it's chronic?
Ay, chronic. Nadugay na.
At cute. Duro.
Araw.
Most common na yan guys si chronic compared kay acute ha.
Mas
Ako
lala.
na mati, if amo lala, do you think
Mas
the
lala
chronic is
aggressive.
way worse than acute?
Well,
No.
based
Mas
sa
lalago
word
si acute.
itself, sir, chronic. It's word
No, it doesn't mean that it's chronic,
Severe siya.
usually severe. No, it's because, feel ko man chronic.
Ay.
Guys, the most common is acute, ay chronic than your acute. Mechanisms of alcohol-related myopathy are unknown. So again, idiopathic if we're talking about drug-induced myopathy. So here guys, we have manifestations. Sino naman yapon guys? Diffuse muscle cramps, myalgia, muscle weakness, no? And swelling. Basta, nantanan related. Since this is acquired, nantanan yung mga manifestation of your muscle, isulat niyo nantanan. Okay?
Yeah.
Complications, same yapon guys. Necrotizing myopathy and your chronic atrophic myopathy. Okay? Sige. Here guys, laboratory test, what you can do is check is to check again si CK. That's it, no? Si CK. Maybe normal or mildly elevated kay chronic alcoholic neuropathy and kay acute alcoholic myopathy, this is usually elevated gid. It's because guys, kay chronic, no, ganda dula aga-abot ng gid siya and the body can adapt. Compared kay acute, nga because of too much exposure, automatic si patients na mag-diagnose na siya with acute myopathy. Not compared kay chronic, nga si body mo is no overly the exposure with the repetitive exposure, dira pa lang siya na-develop ang manifestation of your drug-induced myopathy. Not compared kay acute nga pag-acquired mo gid with excessive alcohol use or drug use, no nagwa na leson ang signs of symptoms. So much more delikado si acute. Okay? In this case, not all acute is good. Okay? Or better ang iyang diagnosis. Chronic alcohol myopathy is usually because of alcohol. And what you can do here guys is to stop the alcohol use and nutritional rehabilitation since there is still a way or difficulty of the patient to stop the use of alcohol. Diba? If from addict ka nagiging sa alcohol guys, very good na to stop. So you need to give additional option which is nutritional rehabilitation just to teach the patient on how to stop the drug-induced or the alcohol-induced and to have other things na ila dapat i-intake. And your acute alcoholic myopathy, so that's usually associated with your rhabdomyolysis, requires urgent medical management, stopping the alcohol exposure, and your fluid resuscitation. It's because, guys, here, there might be a molecular imbalances since associated na siya with acute. Pagka-intake nyo, ara na dason ang diagnosis. Compared kay chronic na si body mo nag-try pa, modify, and adjust. Are we good?
Yeah, we good.
Are we good?
Yeah, we good.
PD assessment and PD management under your myopathy. Give me one, ma'am. ROM. Pwede ROM, but we are not checking for the joint integrity. It's maybe associated with your muscle weakness. Okay? O sige yan, ang hindi pa gusto ka. Strengthening. In what form is strengthening? Progressive resistive exercise. Do you think we can do progressive resistive exercise in a patient? Well, again, as I've said earlier, we can use low load to moderate resistance lang. Okay, we're not here to progress or to improve the weakness but to maintain lang din siya at all. Ano pa? Sir, balik ka na sa medical management?
Medical?
Physical, rather. Sorry lang ah. Sorry lang. Physical. Sige na, son. Ano? O, sige na lang.
Ano sir?
Management.
Isometric checks. Perfect. The isometric usually it's part of your low load. Low to moderate lang din siya. Since there's no motion or there's not enough na energy na gina-use for that. Okay, sige. Tapos na now? Wala pa pa. Sige.
Pwede na
6-minute walk test. If you want to check for the endurance kay patient, pwede. Kay 6 minutes lang man. Pwede. Especially sa mga acquired, pwede siya ma-perform actually. And also guys, some of the strengthening exercises pwede gani ka-give, even mga PREs pwede sa acquired. Okay?
Management naman.
Gait training and balance training. Is it associated kay 6-minute walk test? Gait training, but not balance. Okay? Ano pa? Last one, ma'am.